Hi, this is Group 5's presentation of our ISSP proposal, named Decision Support System to Forecast Disease Outbreak and Re-emergence. I am Romel, and I'll be discussing the problem statement part of the problem domain. The Department of Health has many information systems in place, and there are also ones that are planned to be developed, all with varying uses and scope. Of these information systems, the Philippine Health Enterprise Data Warehouse and the Disease Surveillance System are of major importance in managing disease outbreaks and possible re-emergence. However, the current implementation of the systems in DOH still leaves some gaping holes that needs to be addressed. This proposal would work around three problems, which are: the first is the ineffective use of data and the lack of use of new technologies to process data. Second is the little to no use of predictive analysis and forecasting models, and the lack of early warning indicators for possible outbreaks and surges. The last one is that the current systems just provide aggregated and summarized data, just the plain old kind of data reporting. The different systems does not have the capability to suggest nor give options based on current scenarios and some pre-configured data.
Hi, this is Jeffrey, and I will talk about the remaining parts of the problem domain. Background and objectives of the project. The Philippine government recognizes that disease surveillance is a cornerstone of public health decision making, and so procedures had to be in place to collect infectious disease surveillance data needed to aid in these decision making processes. So the Philippine Integrated Disease Surveillance and Response System and the Mandatory Reporting of Notifiable Diseases Act of 2018 were established to improve the disease surveillance systems in the Philippines. These serve as the first line of defense of the country against epidemics and concerns that pose risks to public health and security. During the COVID-19 pandemic, the DOH and the Interagency Task Force for the Management of Emerging Infectious Diseases used disease surveillance data in implementing measures to flatten the epidemic curve. These measures depended on trends on the disease spread, the health capacity of the country, social, economic, and security factors. However, the strict lockdown measures imposed by the government had devastating effects on the economy. Experts say that these lockdown measures are necessary to strengthen the country's health systems. However, the Philippines was not able to implement an efficient containment strategy of the disease even after several lockdowns, as indicated by the country's failure to flatten the curve. The weakness in the Philippines' COVID-19 containment strategy shows that it is necessary for the country to implement an approach more supported by science and data. It is clear that accurately predicting the spread of infection is important for the government and policymakers to effect initiatives in slowing the spread of the disease, effectively allocating healthcare resources, and avoiding sacrifice of the economy. This project therefore proposes to implement a system that will aid the country in efficiently managing a pandemic through an early detection of a disease surge or re-emergence, help identify infection clusters, and help predict infection outcomes. Significance and scope of the project. The COVID-19 pandemic highlighted the need for quick actions and directions from the DOH and the IATF. So the proposed system will be using the up-to-date disease surveillance data in the Philippine Health Enterprise Data Warehouse. The data will then be organized to execute analysis to determine trends and create predictions in the disease epidemic curve, visualize disease spread, monitor healthcare utilization rate, create various reports for the management and containment of infectious diseases. This will make it easier for the department's executives to get hold of relevant and timely information to address disease outbreaks, enable preparedness with a timely assessment of an outbreak situation, and mitigate the situation by proposing the next course of action, identify areas of concern, and allow the agency to make science-based decisions, applying more focus on social, economic, and security factors in managing an epidemic. Documentation of the existence and seriousness of the problem. The global COVID-19 pandemic, which started in late 2019 and still going as of January 2022, proved to be disastrous for the Philippine economy that had a GDP shrink of 9.5% in 2020. The government imposed lockdowns and movement restrictions caused domestic and international travel to plunge, affecting the tourism, retail, restaurant, and the hospitality industries. The initially imposed lockdowns should have given the government the time to implement measures for efficiently managing the pandemic. However, the country is still dependent on imposing stricter quarantine measures that are harmful for the economy. In September 2021, Bloomberg published a report that the Philippines ranked last in Bloomberg's COVID resilience ranking of the best and worst places to be during the pandemic for the following reasons. Borders are still largely sealed from visitors. The country is still failing to contain the disease with a 27% positivity rate at the height of the Delta variant spread in the Philippines. Community mobility is still below the pre-pandemic benchmark, and the economy is forecasted to only grow 4.5%, which is less than the 2021 projected growth of 6 to 7%. Objectives. This paper aims to suggest a decision support system that will consume any collected disease surveillance data from the Philippine Health Enterprise Data Warehouse, then process the data with the use of necessary technologies, generate reports, perform predictive analysis that can suggest options that will help officials determine and justify the department's next course of action. This decision support system will have the components of visualization, reporting, and notification. The visualization component will provide the view of a disease surge in terms of transmissibility, positivity rate, and healthcare utilization, to name a few. The reporting component will have the functions to generate reports such as vaccination rate, healthcare utilization rate, number of cases aggregated per area, or demographics, among others. The notification component will execute necessary analytics to monitor and determine surge and re-emergence based on incoming disease surveillance data and send notifications to key persons. Deliverables. This project proposal aims to deliver the following components of the infectious disease surveillance, response, and decision management system. The infectious disease visualization component will visualize a disease spread in the form of an infectious disease heat map showing the magnitude of the disease spread in the Philippine map. The infectious disease reports component will provide more understanding of a disease surveillance process by providing the function to generate reports that can be easily customized. The infectious disease monitoring and notification subsystem will provide automated monitoring of disease surveillance situations. The timely data provided by the data warehouse will be analyzed by applicable models to identify disease surge. When disease surge characteristics are identified from the data, the system will alert key personnel with notifications sent through various media. And finally, the system configuration management, which will provide administrative interfaces to control system parameters such as notification parameters, data analysis and modeling parameters, and define alert levels.
I'm Mervik, and I'll be discussing about the review of existing alternatives. Data availability and its accuracy are essential tools in dealing with global outbreaks such as COVID-19. The collected data could be analyzed and utilized to understand the trend and possible surge when handled properly. In May 2020, the UP COVID-19 pandemic response team spotted alarming errors in the Department of Health's COVID-19 patient data, as pointed out in their policy note. They cited problems concerning the DOH data drops, such as timeline of changes in data reporting errors found on the DOH report, data inconsistencies from DOH data drop, and date format reporting inconsistencies. The DOH had since corrected the inaccurate data and launched its official case tracking website that presents the aggregated numbers of active patients, recoveries, mortality rate, individuals tested, and hospital bed occupancy, among others. This is in collaboration with the Epidemiological Bureau and the third-party providers of data virtualization. The data that they gathered from the local governments and public and private healthcare providers are integrated via an official DOH data collection app called COVID Kaya. For the most part, some establishments, as far as contact tracing is concerned, resorted to using either the pen and paper approach to collect personal details of people coming in, or the Stay Safe PH for electronic contact tracing. As to how the data are surrendered to the DOH or the regional IATF is still unknown. Managing emerging infectious diseases goes beyond data aggregation and summarization. In the era of digital transformation, it is already possible to implement predictive data modeling and forecasting with the right parameters and data sets. Manila Bulletin published a report about Okta Research Group, a private survey and research consulting firm, advising the potential for a possible surge since the pandemic began. They were able to predict surge probabilities similar to the actual events. Yet, Okta's contribution was refused by the DOH, stating that such observations must carefully be verified, and that their predictions have become a burden to the government when Okta preempts information on a possible surge. Yet, during a pandemic, forecasting becomes critical for effective governmental decision making, managing supply chain resources, and informing difficult political decisions such as imposing a lockdown or curfews. This project plan aims to leverage the predictive modeling analytics already available in the market. The Philippine Health Enterprise Data Warehouse, and the disease surveillance system to create a decision support system able to provide factors and predicted outcomes critical to decision making. The functionalities that the existing case tracker shall be expanded by including infectious disease heat map, report generation with data segmentation, notification, and configuration management for defining parameters demonstrating identified emerging infectious diseases. The disease heat map will serve as a graphical indicator of surges in various places in the country depicted by colors. This could potentially help in identifying areas that should be placed in granular lockdowns in place of the regional lockdowns enforced in the past. Partnered with notification in place, the assessors and/or stakeholders will receive internal alerts to flag possible surges in certain areas. The data could then be used for assessment and mitigation plans. In addition, certain configurations could be parameterized, which will help define aspects of the emerging diseases and alert level thresholds. This may alleviate manual assessment in place and will cover other infectious diseases considering their varying characteristics and outcomes. The overall goal of this project is to significantly help the country in combating not just the ongoing pandemic, but also other emerging infectious diseases that may spike in the future through data analytics, forecasting, and notifications. Thank you.
Hi, my name is Vina Parian, and I will be discussing the approach to be taken. For this project, the team decided to implement a full decision support system. A decision support system is an information system that supports businesses and organizations in decision making. It is basically comprised of three major components. The first one is the knowledge base, and then the simulation model, and the user interface. The knowledge base is the library of information that is used by the system simulation engine to provide necessary output. The simulation model is the algorithm that utilizes the knowledge base to provide projections, while user interface allows the users to navigate the system. For the theoretical framework, I will be explaining how the decision support system would seamlessly be integrated to the current environment of the Department of Health. First is we have the data set. The data set will just utilize the current data that is coming from the data warehouse of the Department of Health. That will be the Philippine Health Enterprise Data Warehouse. And then the data will be fetched by the data segmentation engine that will be built using scikit-learn. The segmented data will then be forwarded to the predictive data analysis. And for that, instead of developing from scratch, we will be implementing a full epidemic prediction model that was developed by Alibaba. And then the result of the predictive data analysis will be forwarded to data visualization engine that will be built using Tableau. The data visualization engine will display the projections so the users can have better information and decide on the necessary preventive measures to be taken. And lastly, there's going to be a notification mechanism that would notify the concerned unit on the prediction output. We have chosen this framework because we believe that a decision support system would provide relative information to the government while they create policies and decisions to prevent disease outbreaks and re-emergence. Also, the use of open source technology like scikit-learn would reduce the development cost. And using Tableau greatly reduces the development time as compared to other report writing tool that requires heavy programming. Implementing an off-the-shelf predictive technology that is proven to be 98% accurate also reduces the development time, which means the solution would be available the soonest possible time.
This is Romel again, and I'll be discussing the technologies to be used. Our proposal suggests four major technologies that the information system should use, namely scikit-learn, Tableau, Alibaba's epidemic prediction technology, and the different cloud providers. Scikit-learn is the suggested tool to be used for machine learning and data segmentation. Since this Python library is already open source, there would be no software license that needs to be purchased. Also, scikit-learn is pretty popular already, so finding resources to build data models and data segmentation approach would be very easy. Tableau is the tool that would be used to provide data visualization. Using Tableau makes things easier as the user would only have to connect the tool to the PHEDW or any other data sources. The rest of the visualization would be done by a simple configuration. There is no to minimal coding needed, so the new visualizations can be done by non-programmers. Alibaba Cloud's epidemic prediction technology would provide the predictive analysis and forecasting capability of the information system. Instead of developing predictive models and systems from scratch, the department can already leverage this technology. Alibaba already used and simulated this with real-world data and is headlining a 98% prediction accuracy, which is far above any other provider that built a technology of the same kind for the pandemic. AWS, Alibaba Cloud, Google Cloud, and Azure. The proposal suggests that the department make use of any existing cloud service provider in order to take advantage of their pre-built and managed services. Serverless technologies in any of these providers would also be especially helpful in managing budget and making sure that there are enough resources when needed.
Hello, this is Monique, and I will be explaining to you chapters 4 and 5 of the system proposal, which are system design and project plan. This is the use case diagram of the proposed system. The primary users of the system are health officials, which are part of the administrative and executives in DOH, an administrator, which manages and maintains the data going in and out of the system. Apart from the authentication component, which is mandatory, the use cases as described in this diagram can be classified into the three components necessary for the system to work, which are the reporting, visualization, and notification components. The following are the functional requirements of the system. The system shall be easy to use by any person of any computer literacy level. The system shall be able to be used by any person without prior training. The system shall be self-explanatory and intuitive, such that any registered user shall be able to log in, view their dashboard, generate reports, configure settings, and receive notifications. The user interface design shall be as familiar as possible to all the users, such that the UI/UX standards for naming buttons, forms, fields shall be used. It is important that the system shall use code versioning tools such as Git to track, organize, and control changes over source code and avoid confusion. Administrators and users both shall be familiar with the security features that come with the system and make sure they are all enabled. As the system grows, there should be reasonable ways of dealing with that growth. Consistency must be sought to secure high levels of performance, taking into account areas such as latency, resource utilization, and load balancing. The system should continue to work correctly even in the face of hardware or software faults and even human error. Nothing but the failure of the overall system could be detrimental to a member or non-member, since the data should be available at all times. The use of the best available technologies will be the key to delivering the system's acceptable performance and user experience comparable to today's web application. Open source technologies will also be prioritized for their huge community support, vast development resource, and cost, which will be good for the project's maintenance, deployment, and continuity. The system shall have two main components, which are the front-end application and the back-end application. The front-end component will be a web app written using the latest versions of HTML, JavaScript, React, Emotion, and Node Package Manager, while back-end component will be built using PHP, Laravel, MySQL, and Composer. Internal system hardware requirements are as follows. For the disk space, it needs to have 1 GB or higher. For the processor, it needs to have 1 GHz minimum or 2 GHz dual-core processor or more. And as for the memory, it shall be 1 GB minimum or higher. These are few of the prototypes of the proposed system. This is the dashboard page. This is the heat map page. This is the predictive modeling page. And finally, these are the notification section. Thank you.